Good afternoon, and welcome to the Johns Hopkins 30-minute COVID-19 briefing, where we provide live insights from the experts who lead our work at the Johns Hopkins Coronavirus Resource Center. For the next half hour, we'll focus on what you need to know right now about the COVID-19 pandemic and public health responses. As part of this briefing, we'll have an opportunity for live Q&A with our experts, and we'll be offering these 30-minute briefings regularly on Fridays at 12 p.m. I'm Dr. Lainie Rutkow, a professor at the Johns Hopkins Bloomberg School of Public Health, and I'm part of the leadership team for the Johns Hopkins Coronavirus Resource Center. We'll be providing answers in real time today, so please submit your questions in the box at the bottom of your screen. Before I turn to our experts, I want to remind you that the Coronavirus Resource Center recently launched a weekly newsletter called The Week in COVID-19. This is a great way to get the latest analysis from our experts every Monday about vaccines, variants, and other vital COVID-19 trends. You can sign up for the newsletter in the banner that you'll see on your screen throughout this briefing. Today, I'm joined by two guests. First, Dr. Brian Garibaldi is the medical director of the Johns Hopkins Biocontainment Unit and an associate professor at the Johns Hopkins School of Medicine. Brian will give an update about the treatment of COVID patients. Then Dr. Bill Moss, who's the executive director of the Johns Hopkins International Vaccine Access Center and a professor at the Johns Hopkins Bloomberg School of Public Health, will give an update about COVID-19 vaccines. I'm going to turn to each of our speakers for a brief overview. Brian, first to you. We are now officially in our second spring, soon to be summer of this pandemic. What are you most concerned about right now as a frontline provider?
Well, I think there's a few things that are on my mind. I think the one thing that we're worried about is that, we're continuing to see hospitalizations, in different areas of the country. Maybe things are slowing down. We're maybe hitting our peak of this current wave in Maryland now. But the people that we're seeing coming into the hospital are people who, many of them had the opportunity to get vaccinated and for whatever reason did not. And so we're seeing younger people who are coming into the hospital. And in some ways, that's a testament to the efficacy of the vaccines, because I think older people with pre-existing conditions who have been vaccinated are not in the hospital right now. We're not seeing a lot of vaccine breakthrough. But I am worried about how long this is going to kind of, as we see nations start a little bit in the U.S. I worry how much of this could be a fallout to what's happening right now with the J&J vaccine. And we're all waiting to hear what the ACIP committee is going to recommend in terms of that vaccine, but I know in general we tend to overestimate the risk of rare events, and I think we've normalized the risk of COVID because we've been living with it for so long. Many people out there who don't realize that, for most of them, the risk of serious complication or perhaps even dying from COVID is much more likely than the risk of a side effect from a vaccine. And so I do worry that we're going to continue to, at least on the hospital side, COVID units up and running to take care of people who are still COVID, who haven't been vaccinated, and are still going to require hospitalized level of care. And we're learning more about, what happens to people after COVID. So we've talked on this webinar before about, post-COVID or the post-acute sequelae of COVID-19. And obviously we're continuing to learn about this for months and years. How do we prevent it? Who's at risk for it? How do we treat it? But we're also starting to understand that even in people who don't clearly develop a post-COVID syndrome, the risk of medical problems after COVID are higher. So there's a study that recently came out looking at patients who were receiving care in the VA, and compared to people who had never had COVID, those who had COVID had a much higher likelihood of healthcare utilization, hospitalization, and even death in the 6 months after their COVID diagnosis. So I think it's really important to try to put that into the context when people are thinking about, do I want to get vaccinated? The risk of getting COVID right now is very, very real, and that in and of itself can be life. But the risk of long-term health outcomes, I think we still don't know what those risks are in someone who's had COVID before. The other thing that I'm very worried about is happening elsewhere. If we think about what's happening in India, over 300,000 cases every day now, and their healthcare system really is on the verge of collapse. There are hospitals that are running out of oxygen, and people are dying because they can't get oxygen when they need it. And I think this is a terrible reminder that is, even though we're doing better with vaccinations in the US, and hopefully we're going to be coming out of this latest surge, in the coming weeks, this is not over until the rest of the world has access to vaccines, and we've, prevented spread, which can still, create concerning variants that we don't even know about yet. I mean, that's something that's worrying me. I think on the good news side of things, there continues to be real world data about the efficacy of vaccines. And so there's more and more data coming out about, greater than 90% efficacy in preventing infection, fully vaccinated, and really doing well at preventing hospitalization and death. And that's true for, healthcare workers, but that's also true for, people who are lines taking care of COVID patients. There was a nice study that came out of Rutkow University showing that, the risk of fully vaccinated employees getting COVID-19 percent. So vaccine, by and large, certainly with the Pfizer and Moderna, which has been the most commonly used vaccine here in the US, they're safe. And I think we still need to work on convincing people that they need to step up and get vaccinated to protect their own health, to protect their communities, and to help us get back to some semblance of normal, because we're not there yet.
Thanks, Brian. Some important and distressing reminders about the truly global nature of this pandemic. Before I turn to Bill, I want to remind our audience to please submit questions for our experts in the box that you see at the bottom of your screen. And I also want to remind you that we have launched a weekly newsletter that will come to your inbox on Mondays from the Johns Hopkins Coronavirus Resource Center. It is a wonderful way to get the latest analysis from our experts, and you can sign up for it if you click on the banner that you see during this briefing. Okay, Bill, now I'm turning to you. It has been yet another busy week with the J&J vaccine still in the public's eye, both in Europe, in the US, and in other places throughout the world. What do you see as the key developments in terms of COVID vaccines during the last week?
Yes, Lainie, thank you. A lot happening, and I'll come to the J&J vaccine because as we're speaking, the Advisory Committee on Immunization Practices is meeting right now to discuss this. But I thought I'd start with a Friday feel-good moment and reflect a little bit on the celebrations and just happiness that people are expressing when they're getting vaccinated. And I was reminded of this. I completed my second dose of the Moderna vaccine a couple of weeks ago, and last week was able to hug my 90-year-old parents, which I hadn't been able to do for many, many months. And I'm sure others feel that as well. NPR Goats and Soda ran a nice story on what they called post-vaccine happy dance, and they outlined, how people were celebrating their joy at receiving the vaccine. And I'll just give one local example. There was a woman whose wedding reception was canceled here in the Baltimore area because of the pandemic, and she went to M&T Bank Stadium and got vaccinated in her wedding dress. And so people are using the opportunity to get vaccinated to celebrate. And my colleague Rupali LeMay from the International Vaccine Access Center was quoted in the piece saying that sharing fun moments involving vaccines can help shift the narrative from adverse reactions to vaccines. And so we could hear from our listeners about how they may have celebrated their vaccines. But we continue to make progress in the United States, more than 219 million doses administered. We're still hovering around 3 million doses per day, but more than half, 52% of adults over 18 years of age have now been vaccinated. And I think really importantly, as many people know, all adults in the United States are now eligible for vaccination. And so we're no longer in that kind of awkward, ambiguous situation trying to figure out who's eligible, who's not. Everyone's eligible now, and we're going to see that eligibility expand in the coming months as children 12 to 16 or 12 to 18 become eligible to receive the vaccines. More than 27% of the population is fully vaccinated. Fantastic. 1/3 of adults over 18 fully vaccinated. 2/3 of those over 65 years of age. Tremendous progress, but we still have that, those remaining. So what about those who are not yet vaccinated? Lainie, those of us who work in global vaccination know that reaching people gets harder and harder. We talk about the hard to reach child, the unvaccinated child or zero dose child, the last mile, and we're coming up to that. We're going to reach an inflection point here in the United States where we're going to have more supply than, or the supply is going to outstrip the demand. And I think we're already seeing this in some places. Really comes down to two things: access, improving access to vaccines in those communities that are still having trouble getting vaccinated, but more importantly, the demand, building the confidence and trust in the vaccines. The Kaiser Family Foundation recently, has been monitoring vaccine sentiment over time. We're seeing vaccine confidence increasing in the United States over time, but the top concerns remain about potential side effects of the vaccines, and particularly people are worried about having to miss work because of the time it takes to get vaccinated, or the reaction that happens in the day or two after vaccination. So President Biden addressed this issue specifically in his speech on Wednesday. He expressed cautious optimism, I'll say, on the progress that's been made, really touting the fact that more than 200 million Americans have been vaccinated before his 100th day in presidency. But he also has a plan now for employers to provide paid time off for people to get vaccinated, and if they have to take time off because of the temporary reactions that occur. A lot's happening in research. Brian mentioned the increasing data that's coming out on the real world effectiveness of these vaccines, and even against the variants. We continue to see real world evidence that these vaccines remain protective against the variants that have emerged. I just want to highlight one set of research findings around COVID-19 and COVID-19 vaccination in pregnant persons. This is something we've talked about frequently during these webinars. Lainie, it's a question that comes up. Recent study of more than 2,000 pregnant women across 18 countries just came out, highlighting the severity of COVID-19 in pregnant women. 5 times more likely to be admitted to an ICU, 3 times as likely to have severe infection. So there's an increasing evidence that COVID-19 is severe in pregnant women. Now, the good news is that the CDC just published in the New England Journal of Medicine a report on COVID-19 vaccines here in the United States among pregnant women. Over 35,000 pregnant women reporting through VSafe, which is one of the CDC FDA mechanisms for reporting adverse events. And the bottom line, it's complex data because bad things happen, but not necessarily related to the vaccine. But the bottom line is that preliminary findings did not show any obvious safety signals among pregnant persons who received messenger RNA COVID-19 vaccines in the United States. So very encouraging news. There's still more to be done about the safety of these vaccines in pregnant women. I just want to end up on the J&J vaccine. As I said, ACIP is meeting right now. I got to hear a little bit of the presentations. They started at 11 a.m. this morning, just prior to joining this briefing. There was a detailed discussion of the pathophysiology of the clotting disorders that have been reported both with the AstraZeneca and with the J&J vaccine. The technical term is thrombosis with thrombocytopenia syndrome. The thrombosis refers to the clots. Thrombocytopenia refers to the low platelet counts, and that's what makes this a somewhat unusual condition. That and the fact that there's frequently involved the blood vessels in the brain called cerebral venous sinus thrombosis. And there has been work in Europe with the AstraZeneca vaccine identifying antibodies to platelet factor 4. This is very similar to, in the pathogenesis, to something that was known, a heparin-induced thrombocytopenia or an autoimmune heparin-induced thrombocytopenia. And we have some understanding how to manage this. They should not be managed with heparin, but with intravenous immunoglobulin as well as non-heparin anticoagulants. And I think that was one of the important messages that needed to get out very quickly to notify healthcare providers to be on the lookout for this syndrome and how to manage it, and for vaccine recipients to be on the lookout for this syndrome manifested by severe headache or severe abdominal pain. Now, we're still waiting to obviously to hear what the ACIP recommendations are. Their meeting goes till 5 p.m. today. I suspect that they will come out with a warning about these very rare adverse events for the AstraZeneca, 1 in 100,000 or 1 in 250,000. With the J&J vaccine, it seemed to be even a lower risk than that. But we'll just have to see. There are still many advantages to the J&J vaccine: single dose, easy to store. And prior to the pause, many people expressed preference for the single dose vaccine. So we're going to have to see how this plays out and how the messaging goes. But I'm hopeful that we can restore confidence in the J&J vaccine and further increase vaccinations in the United States and around the world, as Brian said, is so important.
Thanks, Bill. We always discuss serious matters in these briefings, and I do look forward to your Friday feel-good stories as a bright spot in them. So thank you for that. I'm now going to turn to the questions that we're receiving from our audience for Brian and Bill. And Bill, first question is for you. What do you anticipate is the impact of the J&J vaccine being put on hold, and what will it mean if later today we learn that the FDA is going to reinstate it?
Yes, it's a really important question, and I know that there are people kind of on both sides, experts on both sides, as to whether a pause should have been put in place at first, and whether it should have been extended or not. I think in the United States, I'm hopeful that the impact will be relatively minor. We obviously have other vaccines that we're using and that are predominant vaccines used in the United States. I think it certainly was critical that these clots be investigated as carefully and fully as possible. Some people have argued that investigation could have continued without a pause and the vaccine continued to be used. But there are many people who felt that helped instill confidence that the process, that this was being taken very seriously and very carefully investigated. I'm a little more concerned about the impact more globally of the pause in the United States, because this does have ramifications beyond our borders, and this can create the perception that this is an unsafe vaccine, or if these both the AstraZeneca and the Johnson & Johnson vaccines are used more widely in other countries, could undermine the confidence in them. So there's no doubt that this is a fine line to walk. I think we'll be, and am hopeful we'll be able to restore confidence in the United States with very transparent and clear messaging, but I am concerned about the global impact.
Thanks, Bill. Brian, question for you. So you've now worked through every season and seeing and treating COVID patients. What do we know, or what have you observed about seasonality and COVID?
Well, I think early on there was some hope that perhaps, like some other respiratory viruses, maybe this would not spread as well in the spring or the summer. We clearly had spikes in the United States during our summer season, and other countries that are in hotter climates have certain mix of COVID. So I don't think we've seen environmental variation as much as it is a variation in terms of what's happening with population movement, adherence to social distancing and mask wearing, and now obviously hopefully a continued impact of the vaccines bringing down transmission. But India right now obviously is in the middle of their worst surge during the pandemic, and they're in a much hotter climate than we are. So I don't expect we're going to see a lot of weather being a real game changer here in terms of spread. It's really going to be vaccines, social distancing, and mask wearing among those who are vulnerable, and really trying to, at some point you'd hope that we would get back to a point where we actually could do effective contacts tracing and try to understand where there might be hot pockets of infection and be able to mobilize resources to them. But we're still at way too high of a daily number of cases for us to really do that effectively, even in the United States.
Thanks, Brian. Bill, I'm seeing a couple of questions come in about this emerging phenomenon in some countries relative to the Pfizer-Moderna vaccine. So the 2-dose vaccines giving only 1 dose or intentionally delaying by months the second dose. Can you talk us through that?
Yes, this is a number of countries have delayed the second dose, and there's been a very vigorous debate about this in the United States and around the world, with experts on both sides of the argument. The issue is, is it better from a public health perspective to get more first doses into more people as quickly as possible in the midst of a terrible pandemic and high levels of transmission, and by delaying that second dose and using those doses to vaccinate more people with the first dose. And I think there are very strong public health arguments for that. We have not done that in the United States, but in the UK that was done, in Canada that was done. And the argument against it is that that partial immunity in people who've received a 1 dose, and we have less of an understanding of that immunity after a single dose, may allow viral variants to emerge or may promote that. There's no evidence, hard evidence, that that's the case. It's more a theoretical argument, but experts on that side of the decision would say that from the phase 3 trials, what we know is how 2 doses work. We don't really know how 1 doses work. So it's a complex issue, and I think there are strong arguments on both sides. I fall on the side of that. I think it would have been worthwhile to delay that second dose and get more first doses into people, but I understand the strong arguments on the other side.
Thanks, Bill. And no surprise, several questions that relate to the J&J vaccine. So one is, we've heard so much in the last week or two about side effects and the J&J vaccine or adverse events of the J&J vaccine. We've heard much less in terms of the mRNA vaccines, but are there side effects or adverse events that we should know about for the Pfizer and Moderna vaccines?
Yeah, so certainly there are the issues around what we call the reactogenicity. I mean, these are very common. This is the soreness at the site of injection, and then the systemic signs or symptoms, the fever, muscle aches, fatigue after the vaccine that many people have experienced, particularly after the second dose. The one big adverse event or side effect that I don't think we anticipated from the phase 3 trials were the allergic reactions that were seen. Those occur very shortly after vaccination. That's why people are asked to wait 15 to 30 minutes after vaccination. We don't have any evidence as of now that there are these kind of more delayed, more severe adverse events associated with the mRNA vaccines. Obviously, this is being looked at very carefully and will continue to be looked at both in the phase 3 trials as those go forward, and in the real world data as people are vaccinated. But I think the experience with the Johnson & Johnson vaccine shows that VAERS system, that passive reporting system, can help us detect potential rare adverse events that then need to be very carefully investigated to see if there's any reason to suppose that there's a causal link to the vaccine.
Thanks, Bill. And one more about the J&J vaccine, and then we'll move on to a different topic, I promise. But this question is, assuming that J&J gets some type of a green light in the US later today, what would we expect to see in terms of allocation? Like when will it start to, or when would you anticipate it'll be out there again?
Yeah, so it's a good question, and I very much anticipate the J&J vaccine will get a green light. Certainly with a warning at a minimum. The other option is or another option is to restrict its use into older individuals. I'm not sure we'll see that, but a number of countries did that with the AstraZeneca vaccine. So there are, my understanding, about 10 million doses kind of that have been held up because of the pause. Those are ready to go. Many listeners will know, though, that there has been a substantial problem with the manufacturing of the J&J vaccine because of some of the problems with the manufacturing plant, actually right here in Baltimore. And so that has been a setback for the production of the J&J vaccines that's quite independent of the pause that was put on because of the investigations into the blood clot. So there is a small stockpile, if you will, 10 million doses that I think would get out very quickly. But we will have to see how long it can take Johnson & Johnson now to fix the problems at the plant in Baltimore and really scale up the manufacturing.
Thanks, Bill. Brian, question for you. If someone gets fully vaccinated, subsequently gets COVID, do we know anything about the likelihood that they will then experience some of these longer term effects that we hear about for COVID?
Yeah, so we're still learning about this, and I think we talked before about how much time is going to need to pass before we really understand all the risk factors for these post outcomes. There certainly is a correlation between the severity of disease and the likelihood of having post-COVID symptoms. And that's not to say that people who have not been hospitalized with COVID don't experience significant symptoms longer term, but a lot of the severe patients who are hospitalized, those are the ones who are having really debilitating symptoms. So there probably is, at least for phenotypes of post-COVID, a correlation between how sick you get and whether or not you're going to have long-term effects. And so what we've seen with most of these vaccines is that they not only do they prevent illness, but they prevent severe illness, death at very, very high rate. And so our hope would be there would be a lower incidence of post-COVID syndrome if you were one of the few unlucky people who has infection after a vaccine, but we simply just don't know yet.
And Brian, a related question, and this is to pick up on you, as you just said, one of the few unlucky people. If someone gets their first dose of Pfizer or Moderna, subsequently gets COVID, what's your advice as a clinician about getting that second dose and when to think about getting it?
Yeah, I think it just depends on timing and how sick you got. If you had mild disease and you were an outpatient, currently the recommendations are to wait until you're no longer infectious or have to quarantine, and then you could consider going along with that second dose. I think 2 weeks to a month seems like a reasonable time frame to go ahead and get that second dose. I wouldn't delay it longer beyond that. I mean, we do think that, at least in terms of protective antibodies, having had COVID before and then getting your first dose of the vaccine leads to the same level of antibodies as if you just never had COVID and had your 2 doses of the vaccine. We're less clear on what happens if you got your first dose and then you get COVID, what that means in terms of protective antibodies or protective immunity afterwards. But we definitely don't want people to get vaccinated in the middle of their acute illness. So, if you're just got diagnosed with COVID and your vaccine dose is scheduled within the next week to 10 days, you probably want to push that off. We just simply don't know, number one, if you might have worse side effects, or number two, how effective that vaccine is going to be in the setting of your acute infection.
Thanks, Brian. Well, we are just at 12:30, so that'll be our last word for this briefing. I'd like to thank Brian Garibaldi and Bill Moss for joining me today, and give a big thank you to everyone who joined us, and especially to those who submitted questions for our experts to answer. This briefing will be archived and available at coronavirus.jhu.edu. And as a reminder, we will offer these regular 30-minute briefings on Fridays at 12 p.m. In each briefing, we'll focus on what you need to know right now about the COVID-19 pandemic, and we'll have live Q&A with our experts. I'll look forward to seeing you at our next 30-minute briefing. And until then, thanks and stay safe.